Hi everyone, this is Dan from Dan Bryant Fitness, and in this video we're starting a new home corrective exercise series, and we're looking at correcting low back pain, knee pain, hip pain, also a little bit of sacroiliac joint dysfunction. I'll talk a little bit about that as we go. So what I want to do, this is going to be our intro video. So in this intro video, what we're going to talk about is one of the main things I want to talk about. I'm going to go through the equipment that we need, but I also want to show you guys how you can assess yourselves. So how you can do like your own posture assessment, because it's difficult if you don't want to go into a clinic or if you don't want to go into a gym. It's difficult, but you may be having these pains, you may be having you may be having low back pain, but you don't really know what to do about it. So this is why I want to kind of bring home exercise into your living room at home, so you can start to see what's going on and you know exactly what to address. So I use the overhead squat assessment. So that's the assessment I'm going to show you guys. I learned that from the Brookbush Institute in the US, who I also happen to work for. That's our top tier assessment. So kudos to Dr. Brookbush for bringing that to me. There's been a real game changer. So that's the top tier assessment that we use, that we teach to our students as well. So it's a really quick assessment, and it highlights the main postural dysfunctions that are correlated with the main patterns of dysfunction that we see. So there's these predictive models of postural dysfunction that come up, and they're correlated with different signs, and I'm going to show you how you can use that assessment to see those signs. I see those signs that are indicative of low back pain, of knee pain, of hip pain. So I'm going to do that with you. I'm going to show you how that works. It's quite straightforward. It might not be perfect because it's always best if you've got someone there, but we could use the camera, we could use a mirror, and you can kind of get an idea of what's going on. Or if you wanted to, you can just send me a picture of your posture to my email, which I'll put just at the bottom there, and you know, I can kind of give you some advice on what's going on. So starting up, so what we want to look at for, I'm also going to just run through the equipment check that we need. So for this series, so it's kind of like what we had before if you watch the correcting flat feet video. So we're going to need a foam roller, trusty foam roller, come in different shapes and sizes, as you've probably seen. I think this is pretty standard as a modern foam rollers go. There's not lots of horns and things and stuff hanging out of it. Some of them look pretty scary today. It's fairly dense. There's different densities with foam rollers. This cost me about £12. They're not too expensive, but you want one that's got a fair good density to it. So when you're pushing in, there's quite a bit of give back. You can get more. You can get ones which are less dense, which you can kind of haven't got much give in them. But I'd say all round, get one that's fairly dense. So I like the longer ones. I find them more versatile. They're not as mobile, but I do find that they're more versatile. So got your foam roller, but for versatility you can always get balls or massage balls. I've got a little tennis ball there. Probably got one lying around your house somewhere. I think you can get them for about 50p. These are definitely more mobile. There's no difference between a foam roller and a ball, guys. Okay, I think I mentioned this in every video. It's just we just use these if we need to. If we need more pressure, if the foam roller isn't giving us the stimulus we need, if it's not creating enough stimulus on those tissues when we're trying to do our release techniques, if we're not getting enough pressure, we can't really feel anything, and it's not doing enough. At the same time, we have to be careful. We don't want to go to the other extreme where we have so much pressure that we start muscle guarding, and you know, we start tensing up and we never get a release. So we have to be careful. We want the right amount of pressure. So if the foam roller isn't giving us enough, we can go to the massage ball. So I've got a bigger ball here, which is quite good, especially if you're getting into some larger areas. So we could progress from the bigger ball to the smaller ball. I'll talk more about that when we get to the release techniques, about those things there. We've also got some fit loop bands. These can come real handy, especially when we come to doing our activation exercises for our glutes. So you can get these online for about £5–6. They normally come in a pack. We've got all different strengths, so they're all color coded. I think the black ones are normally the strongest ones. I think yellow tends to be the weakest one. So they're universally, the colours normally are all the same. Sometimes they're a little bit different, but these are, again, they're light as anything. You can wrap them up, you can put them in your bag. They're super portable. They're really convenient, and they tend to last a long time, providing you don't do anything too crazy with them. So they're really, really handy. So we're going to be using those. I've also got a half foam roller. Not terribly essential for this series. You may have seen me mention this before. They are cool. You could just buy a foam roller and slice it down the middle. You could do that, I suppose. Otherwise, you could get one. I think these again are about £10. But the reason I've got it is when we come to do our overhead squat assessment, we sometimes modify it to see where this dysfunction is coming from, and it's good just to have something that you can put your feet on. I like this because it's quick and easy. So you need something that you can elevate your heels on. You could just get some books, of course, for that, but that's why I've got it. I'll talk more about that when we get to the overhead squat assessment, about when you may need to elevate your feet, when we might need to modify the assessment to see what's going on. But I've got it anyway, so I thought I'd tell you about it. They are really good. I'll talk a bit more about that later. And then the other bits we've got is these big thick resistance bands, or these monster bands. So people get a bit confused between these and these. They're both called resistance bands. I tend to put in CrossFit bands when I buy them. They're popular with CrossFit. They tend to come up more. These are really useful. We're going to be using these, mainly this green one. They come in all different strengths and sizes, but you're going to want one that's fairly strong, probably purple or black. Sorry, purple or green. Because that's going to be, we're going to use that for our mobilizations. So when we come to do like our hip mobilization, our self mobilization that you can do on yourself, these are really, really handy. So we need something that's pretty strong in order to do that. So got those. So that's all of our equipment. These can vary in price, so I should just quickly come back to these. I think they've gone down in price a little bit. I think we kind of went through this equipment, what can I say, scarcity almost with when COVID hit, but things are slowly getting back to normal. These can range anywhere from £5 up to about £20, but I'm pretty sure these big green ones, which are probably what you're going to want to go for, they're about £15-16, but they last forever. They're really useful. I can show you some other things that you can do. They're really, really handy. Okay.